All right. It's kind of a shame that we're not in person for this right now because I get such a kick out of walking around and looking at the different heart diagrams that people draw for this activity every year. I'm going to grab a sheet of paper right now and draw what I'm going to guess 80% of you did. And this is totally normal. I know when I did this in college anatomy and our professor asked us to draw our best heart, I drew something to the extent of this. And some of you guys probably had something like my heart, and that's okay because this is what media tells us is what a heart looks like, even though we all know it's not probably. But that's the best drawing you can probably do. Or maybe some of you didn't know that this is what the heart looks like. But we're going to kind of dissect literally over this lecture what the different parts of the heart are and their functions, and then hopefully we can actually do some real dissections here in class. So I also appreciate that even the Bitmojis, if you're a Bitmoji guy like I am, there's this Bitmoji where they actually attempt to make the heart actually look like a heart. So props to Bitmoji, I guess, but kind of funny. Okay, so we are going to get started with some basic parts. First is the atriums. The atriums are the upper chambers of the heart, and there's no direct flow between atria is the plural of atrium, or the ventricles. So the right atrium of the heart is over here, and the left atrium of the heart is over here. And you have to remember, when we're looking at stuff in class, your rights and your lefts are actually going to be backwards 9 times out of 10, right? Because we're looking at it as if, sorry, the bell's ringing. We're looking at it as if this is our patient or our animal's heart from our perspective. So if we were to pivot ourselves around, it truly is their right and their left, right? Good deal. Then we have the vena cava. The vena cava, there are 2 types of vena cavas. The first is the inferior vena cava. The inferior vena cava is located down below. Inferior means below. And this collects blood from below the heart and brings it upward. The superior vena cavas are located above the heart, and they collect blood from above the heart. The vena cava returns blood into the right atrium. The tricuspid valve is located on the right side of the heart, and it contains 3 fibrous flaps or cusps. The valve located to the left of the tricuspid valve, pictured in the top view diagram. So here's the top view diagram. The one located to the left is the bicuspid valve, right? It's the bicuspid valve. And you can kind of see the 2 distinct flaps on that diagram versus the 3. Okay, so we have our tricuspid valve right here. This is our bicuspid valve. And you can see that there are only 2 versus the 3 on the tricuspid. Ventricles, then, if atriums are on top, ventricles are on the bottom. Ventricles are the lower chambers of the heart, and again, there's no direct flow between the atria and the ventricles, so they don't flow between amongst one another. The atria are on the top, ventricles are down below. Pulmonary valve is the opening of the right ventricle into the pulmonary trunk. This is referred to as a semilunar valve because of the half-moon shape of the cusps. So I'll give you a minute to try to find the pulmonary valve on here, right over here. It has that nice little half moon shape. It allows blood to flow from the arteries during ventricular contraction. Okay, so this is what helps enable blood flow. So our next one is our pulmonary trunk. This emerges from the right ventricle. So remember, ventricles are towards the bottom, and this divides into our pulmonary arteries. Pulmonary artery, 2 pulmonary arteries stem from the pulmonary trunk. One of these supplies the right lung with blood. The other supplies the left lung. Okay, the way to remember too, I didn't mention this in this video segment, but I know we've talked about it in class. Arteries and veins. Arteries carry blood away from the heart. Veins carry blood toward the heart. So A away, V toward. Pulmonary vein, blood leaves the lungs via the 4 pulmonary veins, and they eventually dump into the left atrium. The bicuspid or mitral valve is located on the left side of the heart and contains 2 fibrous flaps or cusps. And we saw a picture of that on the previous slide a couple ago when we looked at the tricuspid valve. The aortic valve is the opening of the left ventricle into the aorta, and it's referred to as semilunar valve because of the half-moon shape. And again, you can see it right there. It also has a half moon shape. It allows blood to also flow into the arteries during ventricular contraction. The aorta is where blood leaves the left ventricle via a single large artery, and arteries branch off of the aorta. Remember, arteries carry blood away from the heart and out to the body. Veins carry blood toward the heart.